NBC Connecticut News at 5.
Stay with us. There is much more local news ahead at 5:30.
Let's check in with Jerry Brooks for a look at what's ahead. Jerry.
Lisa, Keisha, hospitals across the state are warning budget cuts could impact the quality of your care.
I'm most concerned about the patients and about my staff.
But the governor says he just can't raise taxes anymore. A calendar controversy in Milford, why students are being made to go to school on holidays, including Columbus Day and Rosh Hashanah. Next at 5:30.
This is NBC Connecticut News at 5.
A dire warning from Connecticut's hospitals. Hi, everybody. I'm Jerry Brooks.
I'm Keisha Grant. Hundreds of doctors and nurses say the governor's proposed $550 million in cuts will be devastating.
The hospitals say critical services and jobs are on the line. NBC Connecticut political reporter Jeff Saperstone is here with the story. Jeff.
Jerry and Keisha, hundreds of nurses and doctors came to the Capitol today. They've sent these letters to lawmakers. They don't want them to go through with the governor's plan to cut funding. Okay. Bristol Hospital serves more and more patients. The need for care is growing, but nurses say the resources to serve them are shrinking.
We're at our end. I'm not sure we have any more places to go.
Sheila Kempf is the nursing supervisor. She says the $550 million in proposed cuts to hospitals statewide will have an impact.
I'm most concerned about the patients and about my staff.
To illustrate the importance of community hospitals like Bristol, the city's own mayor spoke out, and he became emotional. His life was saved 3 years ago after choking.
I'm happy to be here today, and as Jennifer mentioned, I almost wasn't.
Hundreds of nurses and doctors met with state lawmakers. The governor's office says state funding for hospitals has actually increased every year since 2003.
We've increased funding to hospitals by 242% over the last 10 years. What many people in this building and outside this building are saying is raise taxes. We're not going to.
Furthermore, Governor Malloy says hospital funding stays the same through 2015. Some have criticized hospital CEO salaries, but they say that's not the issue. Hospitals large and small say they will continue to do more with less.
There is no way around it. Cuts of this magnitude will impact patient care.
In the end, we're going to have to cut services that we can't afford to do.
And one of those who spoke out today was Danbury Hospital nurse Andy Hull. You may remember he was shot 3 years ago by a patient. Well, tonight, Hull talks to us about how he's doing and much more. That story tonight at 6. I'm Jeff Saperstone, NBC Connecticut News. Jerry?
Thanks, Jeff.
A Danbury Hospital nurse shot 3 times by a patient in 2010 is sharing his story for the first time. Andy Hull is going public as part of the fight to save hospital funding statewide.
NBC Connecticut political reporter Jeff Saperstone is here with his story. Jeff.
Well, Jerry and Lisa, 3 years ago, Andy Hull was shot while doing his job as a nurse at Danbury Hospital. Today, he's become an advocate for saving state hospital funding. Now, the governor's plan cuts hospital funding by $550 million over the next 2 years. Staffing and critical services could be affected. Andy says nurses shouldn't be taken for granted. To look at Andy Hull now, you'd never know how close he came to losing his life. The Danbury Hospital nurse was shot 3 times, including once in the face while trying to stop a gunman back in 2010.
No, I don't have any anger.
The shooter, an 85-year-old patient, was suffering from dementia.
You know, the gentleman who shot me was suffering from dementia. There was no malice. There was no, he thought that people were trying to hurt him.
Andy is still working, but he's no longer at the bedside of patients.
It's probably not the best place for me now, which is unfortunate because I love to be there.
Instead, Andy is a nurse educator. He's now speaking out as the state's hospitals are fighting back against the governor's plan to cut $550 million over the next 2 years.
It affects every one of us, regardless.
Andy is concerned that quality of care just won't be there if hospitals are forced to cut critical services and staff.
It was instrumental that in my recovery, that they gave me the support needed to do the things to get me to be able to come back to work.
Furthermore, Andy believes mental health services could be the first to go.
I definitely know that mental health plays a role in most of the crimes that are committed. And if you take those resources away from the community, you're going to see a lot more of that.
And the proposal is in state lawmakers' hands now. The governor's office says state funding for hospitals has actually increased every year since 2003, and it is actually staying flat for the next 2 years. I'm Jeff Saperstone, NBC Connecticut News. Lisa?
Thank you, Jeff. Students at one school